Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try and take actions to make a better system for all of us. We're going to talk about a whole lot of things having to do with maternal mortality today and reproductive rights. But before we do, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy daily newsletter. Subscribe for free. The point is that that link is the text for today's video and has all of the background links and all the news story links and study links. Everything is in there. And all of the graphs that you want to see, they're all in there. Okay, so let's get started. Last week, let's recall, the Senate had a bill in front of it to try and make contraception a national right. And Republicans said, go to hell. They said, you don't need that. Who's trying to take away the rights to contraception? And the answer is the Supreme Court is, especially Justice Thomas. So towards that end, I want to let you know that contraception policy matters. Finland offers contraception at no cost. The number of teenage abortions in Finland has fallen by about 2/3 between 2000 and 2023. Its Public Health Institute, THL, said last week. They attributed the reduction to the offer of free contraception to adolescents and compulsory sex education in school. Finland also passed a law in 2022 liberalizing abortion at a time of deep divisions over abortion rights in Europe and court rulings in the US that have restricted access to the termination of unwanted pregnancies for millions of people. You can find a link to a Reuters story about this. Now look, if you were concerned about limiting abortions, what would you do? Oh yeah, make contraception available. All right. In the US, the policy is of course pointing backwards. Republican lawmakers in Missouri have blocked a bill to widen access to birth control pills by falsely claiming that they induce abortion. An anti-abortion group in Louisiana killed legislation to enshrine the right to birth control by inaccurately equating emergency contraception with abortion drugs. In Idaho, a think tank focused on biblical activism, whatever the hell that is pushing state legislators to ban access to emergency contraception and IUDs by mislabeling them as abortifacients. It's hard for me to pronounce that word. Since the Supreme Court overturned the right to abortion 2 years ago, far right-wing conservatives have been trying to curtail birth control access by sowing misinformation about how various methods work to prevent pregnancy, even as Republican leaders scramble to reassure voters they have no intention of restricting the right to contraception, IMHO bullshit, which polls show that the vast majority of Americans favor. And look, in your sphere, if anybody says to you that the morning after pill is an abortion, you say you go straight to hell because you can't get pregnant until 2 to 3 days after insemination. The fertilized egg has to latch onto the uterus and it takes 2 to 3 days. And what the morning after pill does, it precludes attachment. It does not create an abortion. Of course, these people have no science background, and so they can just bullshit everybody. Excuse my language. Let's talk about maternal mortality. Another subject to raise your blood pressure. The Commonwealth Fund has released a new study. Of course, there's going to be a link in the newsletter to it. The Commonwealth Fund has released a new study on maternal mortality in the U.S. The U.S. continues to have the highest rate of maternal deaths of any high-income nation, despite a decline since the COVID-19 pandemic. And within the U.S., the rate is by far the highest for Black women. Most of these deaths, over 80%, are likely preventable. In 2022, there were about 22 maternal deaths for every 100 live births in the U.S. That's far above the rates for other high-income countries. U.S. maternal mortality is lowest for Asian American women and highest for Black women. There is a chart that's in the newsletter that details it. I'll read you the important part. U.S. average is 22.2 out of 100,000 live births. Asian, 13.2 out of 100,000 live births. Hispanics, 16.9 deaths out of 100,000 live births. White women, 19 deaths out of 100,000 live births. And black women, 49.5 deaths for 100,000 live births. The U.S. is the country with the highest rate of maternal deaths of any high-income nation. In comparison, the three countries with the lowest rates are Sweden, with nearly 3 deaths for every 100,000, Switzerland with 1, and Norway with 0. Also, in the newsletter, there is a link to a Wikipedia table that lists the maternal deaths by country for hundreds of them. If you're curious, you can go scroll through that. Nearly 2 of 3 maternal deaths in the U.S. occur during the postpartum period. Compared to women in other countries studied, U.S. women are least likely to have supports that will help them, like home visits and guaranteed paid leave during this critical time. You can imagine if they don't have paid leave and they run back to work and things are not going well, they cannot get to the doctor fast enough and they die. It is horrible. The majority of deaths in the U.S. occur, as I said, in the postpartum period, from 1 day after giving birth to 1 year after giving birth. In the first week, postpartum, severe bleeding, high blood pressure, and infection are the most common contributors to death, while cardiomyopathy is the leading cause of late deaths. Still, more than 1 in 5 deaths occur during pregnancy itself, with heart conditions and stroke the leading cause. Most of these deaths, as I said, 80% of them are likely preventable. The U.S. has the lowest overall supply of midwives and OBGYNs, 16 providers per 1,000 live births. Nearly 7 million women in the U.S. currently live in counties where there are no hospitals or birth centers offering obstetric care and no obstetric providers. And the shortage is expected to only get worse in the coming years. Having regular visits by a healthcare worker are common in other countries postpartum. Many of them, they actually just come to your house. Not so in the U.S. Some states, Medicaid programs, remember that Medicaid is completely determined by the states. Some cover some visits like that, others do not. Private insurance may or may not cover it. And get this, 8 million women of reproductive age in the U.S. have no health insurance at all. Not Medicaid, not work insurance, not nothing. The U.S. stands alone among its peers as the only high-income country where there is no federally mandated paid leave policy, so many women cannot afford to take time away from work when it is needed. Let's summarize. U.S. maternal mortality is a shameful disgrace. Increased visits with healthcare workers would help. Having enough OBGYNs and midwives would help. Paid time off would help. If women were allowed to have full reproductive rights nationwide, then 21 states wouldn't have a problem getting new doctors coming to the state as OBGYNs, because they ain't, because they are scared to be an OBGYN in a state where abortion is illegal. If everyone had health insurance, then those 8 million women of childbearing age would have access to a doctor. If everyone had health insurance, then there could be a chance for all of those women to be seen, and perhaps their lives would be saved. If we had a federal paid time off policy to support families after the birth of a child, that would help women and families. Let's let Congress know they've got work to do, because women's lives matter. Action. Contact your member of Congress and your senators. There is a link for that. If you need to know what it is, I'll put it in the description box. It's www.usa.gov/elected officials. You can let them know the sorry state of maternal mortality and how they can fix it. Universal health care like H.R. 3421, so every woman can go to a doctor. Passing the Women's Health Protection Act to make abortion a national right, so doctors are not afraid to train to become OBGYNs in every state, and a federal paid time off policy. I know this is a lot to remember to put into a call to your representative. Here's something you can do faster. Go to your cell phone, send a text message to 50409, and here's the message. SIGN space PARUVB. Sign PARUVB to 50409, and that's the message you're going to send them. That's what I've got for you today. Down below, you can like, share, subscribe. If you like, you can also send me a comment on any subject you'd like researched. You can also send it to me at healthcareadvocacy1@gmail.com, and I'll be sure to respond to you. Have a good evening. Talk to you soon.